Believe it or not, there has been an increase in STDs during the pandemic last year. We asked our doctor about that. And joining us now on the Factor Uncensored to talk about this disturbing trend is Dr. Danish Ali with Arch Point Pain Institute. Dr. Ali, first of all, before we get into this conversation, when did we go from STD, sexually transmitted diseases, to STI? Is there a difference in the acronym?
Good afternoon, Isaiah. These words are actually interchangeable. Sexually transmitted diseases are used interchangeably with sexually transmitted infections. So disease and infection is interchangeable and essentially saying the same thing.
Now, we have seen an increase during the pandemic of STIs as a result. Why? Why are we seeing this increase in numbers? You were just at home by yourself, or at least that's what we thought.
Right, but folks had partners and other folks that they were with in the home setting, and so that increased the likelihood and chances of folks getting infections. People became comfortable with their close friends or significant others, and perhaps gave away to the condoms and ways to prevent something like this from happening. And so that was one of the reasons. The other reason was a lot of these clinics, these STI, STD clinics were also shut down during this time as well. And thirdly, it was, sometimes it was difficult for folks to obtain these sort of contraceptives. So whether it be going to medical clinics or whether it be going to actual stores, to obtain these contraceptives, that was often difficult during these times as well.
After we got over as a society the fear of HIV and AIDS and the various treatments that are out there now, people in some instances became promiscuous again and have taken STIs for granted. How dangerous, how deadly can these STIs be?
It can be very dangerous, Isaiah, and the reason why is because some of these symptoms may go on for a long period of time without presenting themselves, and they may cause other symptoms and other issues that may be difficult to treat. And so that's why early detection, early prevention is so important, because these are often things that we can avoid, we can treat and cure as well. And so if we don't, they may lead to AIDS and other bad diseases that are often difficult and sometimes uncurable.
Obviously, the first line of defense is protecting yourselves with condoms and other methods that are out there. But if you haven't, and you may be concerned about having these STIs, what would be the first thing someone should do?
Yeah, seek medical attention, Isaiah. There are anonymous clinics. There are community and county clinics out there. There are physicians that are welcome to take care of those folks that may be infected. And it all starts with reaching out. It all starts with looking and doing some research and figuring out what are clinics that are in the community that help serve and help treat these sorts of illnesses. And that's the best place to start.